only wish we could be together in person to celebrate 30 years of the Office of Research on Women's Health. I remember when we learned that the NIH was, for the most part, ignoring women in clinical and preclinical trials. As we later learned, even the lab rats were all male. And that's why the work of the Office of Research on Women's Health is so important. By ensuring that the NIH-supported research addresses women's health, we can gain a better understanding of how diseases and conditions affect women and give more women a chance at a longer, healthier life. We've come a long way, but the fight for gender equity in medical research must continue. Thank you, and here's to another 30 years.
Hello, this is Congresswoman Rosa DeLauro. I'm thrilled to join you in celebrating the 30th anniversary of the National Institutes of Health Office of Research on Women's Health. I was first elected to the Congress 30 years ago, and I worked with my fellow female lawmakers on both sides of the aisle to create the NIH Office of Research on Women's Health. In the early days of time in Congress, it remains one of my greatest accomplishments. In your 30 years, you have changed the way we think about women's health, and in turn have changed the lives of thousands of women across our country. Your work has helped close the gap between men's and women's health research, helped increase the average lifespan of women, allowed us to better identify and treat disease, and so much more. And as you know, there is still more work left to be done to continue to advance women through research. As chair of the Appropriations Subcommittee that funds the National Institutes of Health, I was proud to help secure an additional $2.6 billion increase from last year over the fiscal year 2019 level for the NIH to support the critical research you do. I will continue to work with you in lockstep to ensure that women's health research remains a national priority. The lives of women across the country have been strengthened and extended because of your courageous efforts. And for that, you have my unrelenting support and my gratitude. Although we cannot be together to celebrate this outstanding milestone, your mission remains unchanged. Thank you. Thank you for 30 years of lifting up women through research. And I look forward to working with each of you again soon. Stay safe, and thank you.
Hi, I'm Congresswoman Debbie Dingell from Michigan, and I can't tell you how happy I am to be here today to talk about the importance of women's health research. I first became involved in public service because of the need for that. When my college roommate became sick, had a cardiac problem, and I found out that women weren't included in any federally funded research because we had hormones. Well, we're more than 50% of the population, and we needed to be part of that research. And we successfully fought to have women included in federally funded research. And thanks to Dr. Bernadine Healy, she formed this advisory group, and you've been making a difference ever since. When women have the answers to important health questions and they're informed, they're in charge of the health, and we get better outcomes. Research and information are critical. Congratulations on 30 years, and here's to many more. And I promise you, there are a lot of us that'll never stop fighting for the critical work that you all do.